Today's Fern educational session involves critical long COVID symptoms, brain fog and headache, fatigue and weakness, and chronic inflammations. What are their pathologies, how to clinically diagnose these patients, and how to optimize patient outcomes. My name is Edward Sloan. I'm Professor Emeritus in the Department of Emergency Medicine at the U of I in Chicago, and I'm Medical Director of the PA Studies Program at Dominican University in River Forest, Illinois. I am Fern President and Board Chair. I have no financial conflicts. You can find this information on our fern.org website and our YouTube channel at fern.org. This is a screenshot of our playlist page. I encourage you to go there for more neurological emergencies information. This is my contact information QR. The educational objectives for this session involve a recap of the COVID-19 pandemic and a discussion overview of long COVID. We will then discuss in more detail the COVID-19 pathology caused by the initial viral infection. We will discuss neurological complications seen with acute COVID-19 illness. And then we will begin to discuss long COVID patient pathology, including brain fog and headache, fatigue and weakness, and chronic inflammation. Lastly, we will discuss therapies and lifestyle approaches that can be used to enhance the outcome of patients who have long COVID. COVID-19, the pandemic, and long COVID. The COVID-19 pandemic began in December 2019 with the emergence of a highly transmissible coronavirus, COVID-19, likely from Wuhan, China. Then pursued a 2-year public health crisis that involved the virus infecting millions of patients, causing significant morbidity and mortality. Since the time of the pandemic, there have been long-term effects that have been seen, and a prolonged recovery that has caused ongoing health and lifestyle issues for millions of patients, resulting in significant patient morbidity. 3 of these most important long COVID symptoms include brain fog and headaches, fatigue and weakness, and chronic inflammation. What is long COVID and how is it defined? Long COVID is generally defined as the persistence or emergence of a wide range of symptoms after the initial acute phase of COVID-19 has resolved. Multiple definitions of this multifaceted clinical problem exist. The World Health Organization defines long COVID as symptoms that typically begin within 3 months of the initial SARS-CoV infection and persist for at least 2 months without an alternative diagnosis explaining them. The Center for Disease Control in the U.S. defines it as an infection-associated chronic condition that includes a spectrum of symptoms that emerge or persist well beyond the acute phase of the COVID-19 infection. Lastly, the National Academies of Sciences, Engineering, and Medicine recognize 200 different symptoms that are seen to persist long after the initial COVID-19 infection. What is the epidemiology of long COVID? Up to 60% of long COVID patients experience symptoms such as brain fog, headache, and cognitive complaints. The persistent fatigue and weakness is seen in up to 74% of survivors who then suffer chronic fatigue following COVID-19 infection. In parallel, chronic inflammation has emerged as a key underlying mechanism in long COVID, with elevated biomarkers such as interleukin-10 and C-reactive protein correlating with the persistence of both neurological and systemic symptoms. The epidemiological studies suggest that long COVID, including these 3 symptom clusters, affect approximately 1 to 2.5% of all COVID-19 survivors, translating to tens of millions of individuals globally who have persistent symptoms following the acute COVID-19 infection. In discussing individual symptoms seen with long COVID and their pathophysiology, our first discussion is with brain fog and headache. These symptoms are thought to arise from neuroinflammatory processes that disrupt the normal neurotransmitter signaling and compromise the blood-brain barrier. This leads to an impaired cognitive processing function and altered pain perception. Evidence also suggests that there's persistent microglial activation and changes in key biomarkers like nerve growth factors that underlie these neurological symptoms. Regarding long COVID pathophysiology and the symptoms of fatigue and weakness, these symptoms appear to be linked to mitochondrial dysfunction and impaired energy metabolism, resulting in reduced cellular energy production that manifests itself as post-exertional malaise and diminished muscular function. This metabolic impairment is often compounded by systemic immune dysregulation, bearing similarities to mechanisms observed in chronic fatigue syndrome. Regarding the chronic inflammation seen with long COVID, this inflammation is characterized by sustained immune activation with elevated pro-inflammatory cytokines such as IL-6 and IL-10 that contribute to tissue injury and a prolonged inflammatory state. These interrelated pathophysiological processes collectively explain the whole constellation of symptoms seen with long COVID, highlighting a complex interplay between neuroinflammation, metabolic disturbances, and persistent immune activation. Regarding the patient presentation, when patients are suffering from long COVID, there are several symptoms to consider. Neurological symptoms include brain fog and dull headache, also include difficulty concentrating, memory lapses, and persistent dull head pain. These undermine daily activities and overall mental performance. Post-infectious fatigue studies show that patients report profound fatigue and generalized muscle weakness that cause post-exertional malaise that severely limits physical endurance. Simultaneously, chronic inflammation demonstrates persistently elevated pro-inflammatory cytokines such as IL-6, IL-10, C-reactive protein that suggest ongoing tissue inflammation and injury and sustained immune activation. These overlapping clinical features, cognitive impairments, severe fatigue, and systemic inflammation, show the complexity of long COVID, highlighting the need for multidisciplinary management. How is the diagnosis of long COVID made, given it is complex and multi-symptomatic? Clinicians rely on a detailed patient history, neurocognitive assessments including tests for memory, attention, and executive function, and MRI to detect subtle neuroinflammatory changes in patients who complain of brain fog and headache. Patients with persistent fatigue and weakness are evaluated through comprehensive physical examinations, exercise tolerance tests, and lab tests such as metabolic panels and measurements of lactate. Chronic inflammation is typically assessed by measuring biomarkers such as C-reactive protein, interleukin-6, and other inflammatory cytokines. So what are the long COVID disease mechanisms observed? Testing in brain fog and headache patients has shown reduced nerve growth factor and altered cytokine levels in affected individuals. Persistent fatigue and weakness patient testing has revealed mitochondrial dysfunction and energy metabolism disturbances. Lastly, chronic inflammation has demonstrated ongoing immune dysregulation and sustained inflammatory responses in symptomatic COVID-19 patients. What are the current therapies utilized to help long COVID patients with their symptoms? For patients experiencing brain fog and headache, therapies integrate both cognitive rehab with low-dose naltrexone, selective serotonin reuptake inhibitors, SSRIs, and neuromodulatory agents like guanfacine combined with N-acetylcysteine to reduce neuroinflammation. Fatigue and weakness patients benefit from rehab strategies such as graded exercise programs, energy conservation techniques, and transcutaneous electrical nerve stimulation, TENS, to boost neuromuscular performance and reduce post-exertional malaise. To address chronic inflammation, clinicians commonly employ targeted anti-inflammatory therapies such as low-dose corticosteroids and immunomodulatory agents to lower what are pro-inflammatory cytokines to restore a normal immune balance. What are the expected outcomes in long COVID patients? Many long COVID, brain fog, and headache patients experience gradual cognitive improvement as evidenced by normalization of neuroinflammatory biomarkers and enhanced neuroplasticity documented in serial imaging studies using MRI. Multiple meta-analyses and prospective cohort trials have revealed that fatigue and weakness tends to diminish over a period of several months, with patients progressively regaining functional energy and exercise tolerance. A significant subset of patients show a reduction in chronic inflammation with declining levels of pro-inflammatory markers and C-reactive protein following targeted interventions. These improvements are often achieved through a multidisciplinary approach that integrates pharmacologic therapies, cognitive rehab, and gradual physical reconditioning. What are the societal issues that surround the occurrence of long COVID in the millions of patients who have sustained COVID-19 acute infections? The persistent symptoms seen with COVID-19, including neurological symptoms, leads to significant lost productivity and increased healthcare visits, driving up societal and individual costs. The persistent fatigue and weakness necessitates long-term rehab and support, which directly impacts the quality of life of these long COVID patients and strains public health resources. The chronic inflammation seen with long COVID often leads to complications that require ongoing complex management, which also increases healthcare costs. The combination of diminished work capacity, increased medical expenditures, and limitations in high-quality care for underserved communities underscores the multifaceted societal challenge posed by long COVID, and it highlights an urgent need for comprehensive public health strategies that can improve cost efficiency, quality, and access to care for long COVID patients. So our conclusions regarding our overview of COVID-19 and long COVID patients. The disease. The COVID-19 pandemic was a remarkable world event. The virus caused a wide range of long COVID symptoms, including brain fog and headache, fatigue and weakness, and chronic inflammation. Long COVID is defined for patients as having varied persistent symptoms following the COVID-19 infection that are not otherwise explained. Long COVID is seen in 1 to 2.5% of COVID-19 infected patients. Symptoms such as brain fog, headache, fatigue, and weakness are seen in up to 74% of patients who have survived the acute COVID-19 infection. Chronic infection following COVID-19 infection can be detected by measuring CRP, IL-6 and IL-10 levels, and levels of other inflammatory cytokines. In conclusion, regarding our discussion of long COVID, we then consider mechanisms and the diagnosis of long COVID. The mechanisms for brain fog and headache symptoms include reduced nerve growth factor, microglial activation, blood-brain alterations, and chronic neuroinflammation. The mechanisms for persistent fatigue and weakness include mitochondrial dysfunction and energy metabolism disturbances. The mechanisms for chronic inflammation include ongoing immune dysregulation and sustained inflammatory responses, as seen with elevated inflammatory cytokines. The clinical diagnosis, therefore, of long COVID relies on a detailed history and physical exam, as well as specialized tests such as neurocognitive assessments, brain MRI, exercise tolerance tests, metabolic panels, lactate and nerve growth factor tests, and tests for chronic inflammation. In conclusion, regarding long COVID and our treatments and outcomes, patient treatments for brain fog and headache include cognitive rehab, SSRIs, naloxone, and neuromodulatory agents that reduce neuroinflammation. Patient treatments for fatigue and weakness include graded exercise programs, energy conservation techniques, and TENS use. Patient treatments for chronic inflammation includes low-dose corticosteroids and immunomodulatory agents. Patients are seen to have gradual cognitive improvement, reduced neuroinflammation, and MRI-proven enhanced neuroplasticity with treatment. Patients with fatigue and weakness symptoms see these symptoms diminish over months with progressive improved functional energy and exercise tolerance. And a reduction in chronic inflammation is seen following targeted patient anti-inflammatory interventions. And in conclusion, regarding the long COVID societal issues, we see that there is significant morbidity, healthcare costs, and societal costs that are associated with long COVID as a disease and the care of these patients. Lost productivity, increased healthcare visits, long-term rehab, and a disrupted quality of life all strain private and public health resources. Complications that require ongoing complex management, a diminished work capacity, and increased medical expenditures all impact the health of the public. And we note that there are limitations in high-quality care options for underserved communities and their patients with long COVID. There is therefore a multifaceted societal challenge posed by long COVID and an urgent need for comprehensive public health strategies that improve cost efficiency, quality, and access to care for long COVID patients. What then, therefore, are our recommendations regarding long COVID patient management? It is key to continue to monitor the scope and extent of long COVID disease. It is necessary to support research into the mechanisms of long COVID symptoms and to explore novel mechanisms and treatments for these long COVID symptoms. It is important to assess the societal costs associated with long COVID and to enhance access to long COVID patient care for all patient populations. It is useful and helpful to create a supportive public health environment for long COVID patients and to educate clinicians and patients about long COVID, the disease. Thank you for participating in this FERN educational session. You can find this video and others on our YouTube channel at fern.org. Have a good day.